Yes, of course, quite important as well as for the adult form of multiple sclerosis, for the demonstration of dissemination in time and space of lesions. But again, as I said, in relation to clinical aspects, there are some differences compared to the adult form. First, the typical pattern of lesions observed in adults cannot be found in pediatric patients, and the usual criteria frequently are not totally fulfilled in pediatric patients. So there has been an interest to try to find new criteria for this age in order to predict the evolution of multiple sclerosis for patients with an acute onset with a so-called acquired demyelinating disorder. The French group has proposed the so-called Kidmus criteria. The Canadian group has proposed the so-called Werleigh's criteria. And probably this criteria, the criteria proposed by the Canadian group, has been validated in the court of patients observed in Canada, but also have been validated in an European court, suggesting that if we find at least one hypointense T1 lesion or at least one T2 lesions, patients having this pattern have a high risk of developing multiple sclerosis with a high sensitivity and a high specificity. So in the future it could be useful to use this criteria for patients with the first episode suggesting multiple sclerosis.